Welcome back. I'm Dr. Cheek. I'm a licensed clinical psychologist, and in honor of Women's History Month, today I'm going to make a video predominantly focused on a mental health disorder that typically focuses on women and women's health. So today I'm going to be talking about premenstrual dysphoric disorder, or PMDD for short. Now, I know a lot of us have heard about it, but I'm going to go into a little bit more detail about what it is, what are some of the symptoms, how do you track it, what are some of the treatments. So PMDD is kind of like PMS, but it's more intensive and more debilitating. PMS, as I'm sure most people have commonly heard of and have noticed that some women do experience when they experience their menstrual cycle each month, refers to those symptoms, those mood changes. So you may feel mood swings, mood changes, changes in emotional stability, changes in diet, changes in tiredness and activity levels around probably the 14 days before the start of your cycle. Premenstrual dysphoric disorder, or PMDD, are those same premenstrual syndrome symptoms. However, they are heightened and elevated to the point where it leaves you to feel like you aren't able to kind of function normally. You can't engage socially, you can't engage in your environment, and you sometimes have to take other initiatives to be able to function. Unlike PMS, when we experience PMS symptoms, we are sometimes able to continue to function. We notice those changes, but they're not as debilitating. However, PMDD, there is some level of debilitation or some level of inability to function on a somewhat of a normal level. Now, not all women experience PMS or PMDD. Is a subset of women who experience either. The symptoms that are typically associated with premenstrual dysphoric disorder is, like I said before, like you'll notice like your mood change, you're having extreme mood swings. You may feel like you have elevated depression or elevated anxiety. You may notice changes in your eating habits. When I say changes in your eating habits, you're eating more, you're craving more sugars, you're wanting to eat more carbs. You may notice that you feel more tired. You may feel that you don't want to engage socially, so you find yourself socially withdrawing. And you may feel like you are easily angered or irritable. You may have like crying spells where you cry and you're not able to kind of put your finger on why you're feeling so emotionally fragile. You may feel like everything is going wrong when in actuality nothing is really wrong, but it feels like everything is outside of your control and everything is going completely haywire. These are typically the symptoms that are associated with PMDD. You may notice some aches and pains like bloating, back pain, joint pain, and things of that nature. That is common as well as headaches. So all of those things are common symptoms associated with premenstrual dysphoric disorder, and you may notice them as well with PMS, but again, they're not at that same level of intensity or that same level of functional instability as would be present with someone who has PMDD. Now, some studies indicate that one of the causes for premenstrual dysphoric disorder is a drop in your serotonin levels. Now, serotonin is the hormone that is generally found in our intestines or our gut, and it's found in our brain as well. And it regulates our mood as well as our digestion, as well as sleep and other aspects of your life. That seems to be what some studies seem to show is indicating a changes in those hormonal levels about 14 days before the start of your cycle. So how do we get to a place where we diagnose PMDD? Now, diagnosing a PMDD requires that you actually track these changes in your mood. I tell people all the time, we are our own worst historians. Most people can't remember what they had for lunch yesterday or breakfast, let alone how they felt 2 weeks ago and how intense it was. So since we are our own worst historians, we tend to not be able to keep track of what's happening and when. So I encourage most people to kind of track not only your cycle, but track those subtle changes in your mood. You start to notice that you may cry at commercials, or you cry at random things, or you start to notice mood swings, or you start to notice that things that people do that didn't used to bother you as much seems like a very severe irritant. You start to notice like these subtle changes and start to track when that starts for you and start to become more aware of if those symptoms are present once your menstrual cycle has started. Normally with PMS as well as with PMDD, once your menstrual cycle starts, those actual symptoms start to subside. So if that is the case, you need to track that for at least 2 months. And when you track that, I want you to have a conversation with your primary care physician, your psychiatrist, and or a psychologist or the mental health provider to kind of talk about strategies or treatment options. So how do we treat PMDD? We treat PMDD in multiple ways. One of the ways is we treat it with the SSRI or antidepressant that kind of helps manage or stabilize your mood. Also, there are behavioral strategies that you can learn to manage those symptoms when they're present, to make sure that you're able to communicate with those around you what's happening and learn how to navigate or actually prepare yourself for these things happening each month. And being able to bring in that awareness through tracking can help you know when you need to start to make those behavioral changes when that cycle change is about to happen, or those 14 days prior to your cycle. Also, there is hormone replacement or hormone treatment, and that's normally through oral contraceptives or birth control. Not everything works for everyone, so I ask that you at least try at least one or two of those things to see if it actually helps. But bottom line is that you have to learn how to navigate these emotional changes, those mood swings, those changes in behavior, and you have to actively do things differently around that time, because those things are going to happen for you each and every month. There is not a magic pill to make it go away completely. There is the ability to learn how to communicate your needs and what's happening for you with others around that time. And there's also the need to learn how to do things in your environment to help make sure that your needs and your overall mental health is taken care of during those times when those mood changes and those different symptoms are present. So that is typically how we treat premenstrual dysphoric disorder. So it's either going to be therapy, cognitive behavioral therapy, or therapy in general, hormone replacement, so oral contraceptives or birth control, as well as taking an antidepressant or a serotonin reuptake inhibitor or SSRI. So what I hope you learn from today is having mental health concerns on a monthly basis can be attributed to you being a woman. However, I know sometimes people feel offended by that statement or offended by that idea of me simply being a woman affecting how my mental health is happening. But it's not simply you being a woman, it's you understanding the changes in your hormones that is occurring around that time because you are a woman, that is actually affecting your mood. It is affecting your behavior. It is affecting how you are interacting with your environment and how you are viewing and taking in the information from your environment. And that is real. PMDD is real. PMS is real. These things happen. Track them. Be aware of them. Notice that they're happening for you each month or every 2 to 3 weeks. Notice that this is happening for you. And if this is happening for you, you can make a change. And I am not going to be the one to say that change is easy. That change, that behavioral change is not easy, but it's actually necessary in order for you to function at home, at work, and any other external environment outside of your own body, and sometimes even within your own body. Understanding yourself, being aware of what's happening for you hormonally, emotionally, mentally, physically is always the number one key to actually getting to a point of resolution. Because if we aren't aware of it, we can't make the changes. So I hope you've learned something from today's discussion. I hope you take from this information that is vital and useful for you. And I hope you learn to kind of track those moods, even if it's not related to PMDD. I thank you so much for taking the time to listen, and I'll be seeing you again very soon.